Gluten is a protein found in wheat, rye, barley, and sometimes oats, and gluten-free foods seem to be everywhere these days because many people are reducing or eliminating their dietary intake of gluten. In this video, I'm going to go over the differences between a wheat allergy, celiac disease, and non-celiac gluten sensitivity while looking at the symptoms and what you need to know for each of them, so stay tuned till the end. Hi guys, you've seen our Son Media Pharmacist here on YouTube. This week's video is on gluten sensitivities. If you haven't already, smash the like button below now as I greatly appreciate it. It also helps out the channel so much. Also, while you're at it, hit that subscribe button too to stay up to date with new weekly videos. And without further ado, let's talk about gluten. Gluten is a type of protein found in the grains of wheat, barley, and rye. It gives these grains structure and flexibility and holds them all together. Without gluten, things like bread and pasta easily fall apart or have a stiff, hard texture, not being chewy at all. When discussing gluten, it's important to differentiate between the three major reasons why a person could have a gluten intolerance. The first is a wheat allergy. Wheat is one of the top 8 food allergens in the US, and it basically starts when an immune response happens, and symptoms usually take place within minutes of consuming wheat that can cause nausea, vomiting, diarrhea, difficulty breathing, hives, and etc. And it's most common in children. Your doctor will likely prescribe an epinephrine auto-injector such as an EpiPen if you're diagnosed with a wheat allergy. Also, you could use this to prevent anaphylaxis if you accidentally eat wheat. The second is celiac disease, which is the most severe form of gluten intolerance. It makes it difficult for your gut to absorb nutrients and is estimated to affect close to 1% of the population and about 1 in 141 Americans, though many cases are undiagnosed. If you have celiac disease, eating gluten will cause your immune system to destroy your villi, which are the finger-like parts of your small intestine that are responsible for absorbing nutrients. Without healthy villi, you won't be able to get the nutrition that you need, which can lead to malnutrition and permanent intestinal damage. Symptoms of celiac disease include, but not limited to, bloating, chronic diarrhea, constipation, pale, foul-smelling stool, stomach pain, and nausea and vomiting. How to tell a wheat allergy apart from a celiac disease? Good question. Your doctor will need to conduct a blood or skin prick test, which is dependent on the presence of gluten in the body. Before going into the test, talk to your doctor about being gluten-free first before actually being tested, because you don't want to have an incorrect test with a false negative. Sometimes it could be a hard time distinguishing between a gluten intolerance and other gut-related disorders such as irritable bowel syndrome, so they may order further testing and continue monitoring your symptoms. And lastly, there's non-celiac gluten sensitivity, in which you're sensitive to gluten without having celiac disease. The fact that gluten causes symptoms in people without celiac disease was described in the case series in the 1980s, but it wasn't until the 2000s that data showed us that removing gluten in the diet could improve symptoms in patients without celiac disease. Unfortunately, we aren't sure why people develop gluten intolerance. Some research suggests that the consumption of a class of carbohydrates called FODMAPs may cause them. The theory is that a person, when removing FODMAPs, which includes gluten from their diet, symptoms of gluten intolerance may then improve. I left a link in the description below on what FODMAPs are and how to eliminate them. Unfortunately, there is no test that could actually diagnose you with non-celiac gluten sensitivity, and the most common symptoms of non-celiac gluten sensitivity are mental fatigue or brain fog, feeling tired all the time, bloating, abdominal pain, and headaches after eating gluten foods. So your best bet is to keep a food journal and track all the foods and the symptoms that each food gives you, if any. You could still have a gluten test to make sure, and your doctor may advise you to actually begin a gluten-free diet right away. So there you have it, the 3 major causes and symptoms for each gluten sensitivity: wheat allergy, celiac disease, and non-celiac gluten sensitivity. Understanding which condition you have is important so that you can rule out certain foods and follow the appropriate treatment recommendations. Remember, if you do have celiac disease, after you start on your gluten-free diet, your small intestine will start to repair the damage to its villi, and after a while, your body will begin to absorb foods normally again. Your digestive symptoms will begin to disappear, and you should also start to feel much better. Diet really is the main way to treat gluten intolerance or gluten sensitivity, and a big question many have is, how do I remain gluten-free? And a big part of a gluten-free diet is to avoid foods made with wheat, rye, or barley. Again, this means most regular breads, pizzas, cereals, pastas, cakes, and cookies. Also, many processed foods contain hidden gluten too. The most common culprits are soy sauce, gravies, canned soups, nutritional bars, barley malt, and even some veggie burgers. I left a link in the description below from the NIH that looks at more foods that contain gluten that you should be aware of. So check that out too. You can replace gluten-free foods with gluten-free substitutes that include brown, white rice, quinoa, almond flour, buckwheat, corn, or potato products, noodles that are made from beans and lentils, and nutritional yeast instead of brewer's yeast. Another thing I want to end with is that you should be careful when replacing gluten foods with foods that are gluten-free. The NIH says that packaged gluten-free foods aren't necessarily better or healthier. In fact, some gluten-free foods are higher in fat, sugar, and total calories than foods with gluten. As with any diet, you need a variety of nutritious foods in your gluten-free diet, as this is going to actually determine how healthy your overall eating is. I hope this breakdown was useful to you guys, and I hope that you did enjoy this video. Like the video if you did enjoy it, and subscribe to stay on board with all my other weekly health and wellness videos. Thanks for sticking tuned all the way till the end, and as always, I'll see you on the next one.